Hello, and welcome to the CAP Today webinar for Thursday, January 25th. I'm Bob McGonnagle, the publisher of CAP Today, and I'll be your host and moderate a question and answer session after our formal presentations. Today's webinar is entitled Empowering Pathology Partnerships for Growth and Rewards with GoPath. This webinar is made possible by a special grant from GoPath Diagnostics. We want to acknowledge them and thank them for their support to bring you this important program. Our speakers today, and I'll say a little bit more about them in due course, are Dr. Jim Liu, who's the CEO and Medical Director of GoPath Diagnostics, and Dr. Ken Bloom, who's currently the Head of Pathology at Nucleai, the spatial biology company. But before we begin, let me give you some housekeeping tips. I suggest you might refresh your browsers. We do have technical help available at all times here by calling 858-345-5916, as you see there on the lower left hand of your screen. Also, in the question and answer box that you see below my photograph, you can, again, ask for technical help and support, or you can put in comments and questions, which we'll address after the formal presentations. I want you to know that we'll plan to put this online in about a week or so. You'll also see some follow-up emails from ourselves and perhaps from GoPath Diagnostics, so I want you to be alert to that. Finally, I need to note that CAP Today does not endorse any products or services that may be mentioned today. Any remarks of my own are purely personal, not to be taken as the policy of the CAP Today or the College of American Pathologists. And now to begin, I have a special guest, the Director of Commercial Operations for GoPath Labs, Dustin Suntheimer. And he's going to give you a very brief introduction to the agenda you see there, and then our speakers will go off. Dustin, go right ahead.
Thank you very much, Bob. I appreciate it. Good afternoon, everyone, and welcome to today's presentation. And I would like to start off and thank Bob McGonnagle and the team at CAP today for helping GoPath introduce our first-in-class program. What we're going to talk about today is called Merge and Grow. Today, you're going to hear from GoPath's founder and CEO, Dr. Jim Liu, and then the nationally renowned industry expert, Dr. Ken Bloom, as they detail the pain points at community-based pathology and how the advanced diagnostics and digital platform offered by Merge and Grow will put our corporate infrastructure behind your practice to accelerate your business. You'll learn the story behind GoPath Diagnostics and how our business portfolio will help you support your hospitals and your patients. From there, Dr. Liu will give you an overview of our facilities and our advanced testing capabilities. Then we'll detail some of the benefits of the Merge and Grow program and how it will help you and your practice build an exit strategy for the years to come. We will follow up with a few polling questions at the end that Bob will moderate, and then we'll wrap it up with a Q&A session where we will take the questions throughout the webinar today and answer them as time allows. And with that, Bob, take it away.
Thank you very much. And our first speaker with an overview of how there are some new pain points for pathologists. There's no one better suited to lead you through that than Dr. Ken Bloom. He really needs no introduction. We first heard from Dr. Bloom when he was at Rush Medical Center here in Chicago. And as I said today, he's at Nucleai. And you've seen him most recently in the issue of CAP Today, giving us a very, very good overview of the hot field of spatial biology. So it's a great pleasure to welcome him here, and I'm sure you'll enjoy his comments. Dr. Bloom, please go ahead.
Thank you, Bob, and good afternoon, everybody. I have the pleasure of talking to you about really all of our careers. I've started this journey about 40 years ago in pathology. Life was a bit simpler back in those days in terms of what our jobs as pathologists were. But over those last 40 years, I've really seen the field of pathology dramatically change. And it's changed because really the advent of precision medicine. And as medicines and therapy options have changed for patients, not only has that created better outcome for patients, but it's changed the questions that need to be addressed by us as pathologists. And nowadays, instead of just diagnosing that the patient has tumor and are the margins clear and are lymph nodes involved, now more and more frequently we're asked about the actual markers that are present in the tumor. And as we're emerging now with antibody drug conjugate therapies and immunotherapies, targeted radiotherapies, and all of these various combinations, it's now incumbent on us to answer questions that we probably were never really introduced to during our residency. So I always like to say, when I go back and I look at my residency, that was really at the advent of immunohistochemistry. Flow cytometry was really just starting. There was no such thing as FISH, no such thing as molecular testing, certainly no such thing as machine learning, artificial intelligence, and spatial biology. But now all of these components become necessary for us to provide detailed analysis for our clinician colleagues so that they can apply the right therapies to the right patients. Could somebody advance the next slide? For some reason, my keyboard's not doing
There you
it.
go.
Perfect. So that really introduces a whole variety of pain points to us. We would all love to, wave a magic wand and say, wow, I can get all the equipment that I need, and I could come up to speed on all these new technologies, and I could hire all the appropriate staff, and I have infinite resources to do all these things. But of course, that's not the case. So from our clinical colleagues, we get increasing demands. They're taking more and more biopsies with smaller and smaller samples, and they're asking us to deliver more and more information from those ever-reducing size samples. They're asking us to explain what are all these new tests that people are talking about, because they haven't been trained in those either, and so they're coming up to speed. What's a companion diagnostic, and what's FISH, and what's NGS, and which genes are important, and should I be doing germline testing? All of these things, they are leaning on us as the experts in testing to really educate them on where it should be used and how it should be used. And of course, that puts more pressure on us. We don't necessarily have that training, so we have to go out and get that training. A lot of us lack the subspecialty expertise that's necessary nowadays, and so we have to acquire that knowledge or partner with others. And of course, it's the ever, growing shortage of laboratory staff to aid us in doing these tests. And even if all that magically fell into our hands, we still need our medical centers to give us more laboratory space, buy the equipment, upgrade our LISs, and put in new infrastructure like image management systems. And the amount of new technologies that are coming are absolutely mind-boggling. So, just when I started, there was no such thing as digital pathology, no such thing as next-generation sequencing. We didn't even think about things like early detection beyond PAPS. Cytology was our early detection mechanism. Spatial transcriptomics, and now computer vision and AI. So really, it's incumbent on us to figure out how are we going to overcome these things. Money doesn't grow on trees. The demands aren't going to stop. Technology's not going to stop. And so how do we envision our practice really moving forward within this new space? So next slide. So to really do this, somebody please, yeah. So to really do this, we need a new strategy. And, I look at all strategies have to be win-win. So obviously, as a pathologist in any organization, you definitely want to figure out how you're going to increase your revenues and create stability for your organization. You need to figure out how you're going to be what I call the diagnostic hero. How are you going to be the one that explains these new technologies to your medical staff? and gives them a groundwork for how they're going to incorporate these new diagnostic tests into their patient care. And of course, the medical center is going to continue to put pressure on you to reduce your costs. You've got to do this within budget and within platforms. And so what you're going to hear today is a concept that's been put forward by GoPath Laboratories that really provides an opportunity for you as community pathologists to figure out how to do all this, how you're really going to increase your revenue, become more stable, reduce your costs, educate your clinicians on what's going on, and hopefully for those of you that are thinking a little bit long-term, how you might retire one day. Do you just like, okay, I stop working, or could you benefit from all of the hard work that you're putting into growing this business for yourself and for your community? So the Merge and Grow program is, this unique program that offers you the ability to participate and benefit from all of these particular features. So I'm going to pass it on at this point to Dr. Jim Liu, the CEO of GoPath, who's going to explain their vision and how you might be able to participate in that vision as well. So, Jim?
Okay, thank you. You can hear me well, right?
Yes.
Okay, good, perfect. We had some technical difficulty at the beginning. That's why the webinar delayed a few minutes. Thank you, Dr. Bloom, and for the stage you set, and all your pinpoints are well taken. A little bit about myself. I'm one of you guys, many years, 10 years ago, and I started this journey and with some braveness. And I was trained at the UPMC and joined Ameripath in 2004. Practicing the GI, and read the cases every day. And I hear some noise in the background. I hope it's okay. And then I start to, after like 4 or 5 years in practice, I realized that the molecular questions often come up from clinicians. They ask why we're doing the EGFR and why we're doing the KRAS, all the things. Also, digital pathology start to play. I still remember the old version of digital scanner, Trussell, the salespeople put in my office. I realized that, hey, this is really something cool. And down the road that this could be a potential business. That's why I start to talk to my colleagues, basically at the lunch table, and say, okay, and is there anything we can do for any business opportunities? And because of my background and with PhD, also a trend at the UPMC, I have to say UPMC actually is the leading institute for the molecular and digital. I had very good exposure during my residency training. So we start to think that maybe we can build something around that. So initially we built a website called GoPathDX.com, and at one point this webinar series, probably I bet some of you probably know this website. At one point we have 15,000 members. Join our sessions, and so by 2012 we decided to set up a physical lab in Chicago, and with vision that combining digital and molecular pathology into our surgical pathology practice. And I see this is coming, and the pain points that Dr. Bloom mentioned, and actually at that time I feel this could be issue, so I set it up this with some advanced visions, and by 2017 we finished all the molecular menu, and last year we are total digital. And it's a very significant milestone for us. And this year we would like to see that how can we bring this platform to you guys? And so we create this Merge and Grow program. And of course you will have a chance to understand more in the following time. And as Dr. Bloom mentioned that. the chance that by working together, there's an exit strategy, like IPO exit strategy. That could be something that we can entertain. And let me see if I can advance. Okay, I can advance the slides. Okay, here is the overview of GoPath Diagnostics. So through these years, we have built full service of for pathology. In addition to surgical pathology, we have built the molecular pathology and heme paths, and also the digital pathology. We also have biopharma program, R&D program, and we also have our independent and billions team. Also, that we have great national sales team that can bring business up. So and we're also the clear CLAB certified California. We can talk about more in the platform we have. And this is just some pictures that we have that, left upper is our 10-year anniversary. The building behind is our headquarters. And currently we have over 120 employees now. And the left low is one of the U.S. CAP meeting for last year. And the right side is our booth at the AUA meetings, one of the largest urology annual meetings, and we have a big presence there. This is the pictures that of our lab. 30,000 square foot facility, very nice facility, and so you see that we have area of AP and molecular, and then there's a cytology lab, and also the molecular NGS room. Then the histology room, also digital pathology room, and it's not easy to build something like this. It's through all these years, experience, the investment, all that. We finally build something actually is very unique, combine anatomic pathology, molecular and digital all together. And next few slides you will see that actually what we are offering in detail. And this is a slide that I want to say is very important. And we basically follow the patient journey while we are developing our test. Okay, so you understand that pathology is the most important one, tissue diagnosis. This is at the left upper corner, and that's where we started, right? So I always tell people, GoPath is a pathology company to start with. So on the top of that, if we follow the patient journey, let's say cancer patient, okay, someone is diagnosed cancer by us, but us pathologists, right? So the next things will be like a treatment, okay? What treatment do we need? What treatment do we need to develop the test, like targeted therapy part, okay? So this will be like all kinds of the therapy that you are familiar with, and like anti-EGFR therapy, like ALK fusions for lung cancers, for the HER2, all that, right? So we're building all that panel under OncoTarget series, okay? So after we identify the therapies, and then next question will be the onco-tracking, the concept of whether cancer will come back. And nowadays you probably hear a lot about the MRD, minimum residual disease. We're going to talk about that also in the detail. And so the next is that for cancer patient is that whether family members will have potential to be prone to develop a cancer. So this is why we developed a test called Genetics Now series. Okay, so this will complete the patient journey in the way that we will provide all the testing service for patients, especially when they have cancers. I think that this portfolio serves the company very well in terms of market presentations. So these slides show that we have very solid, surgical pathology offering, and basically including the most of the subspecialties and very strong, IC platforms, and also the FISH platforms, flow cytometries, and so we can pretty much serves all our clients' needs in terms of the tissue diagnosis. We emphasize very important that turnaround time, client service, and make sure that our report delivered to clinicians' hands on the right time. And another thing is very important for our practice that we generate a very nice, easy to read report. And you can see that in the middle part, this is two reports that see that we turned most of surgical pathology report into one-page report, and actually, and also that for the heme report we often combine and into a single-page report as the integrated report. So physicians love this format for them to be able to pick up the information quickly. You can see left side of the report is a prostate report. You can see that we're color coded, and the doctor can immediately see that left side, the right side has cancers. And so this is also an important part of our offering. So this is for the surgical pathology, and another one is targeted therapy testing, right? And on the right side, you can see that we developed pretty much the molecular testing for all cancers. Okay, and so pretty much can help the clinicians in different subspecialties, especially to highlight that we have this large panel called OncoTarget 500, and this is FDA cleared somatic panel, and turnaround time is pretty good, 7 to 10 days. Then we also developed our panel called myeloid panel, and this is for myeloid leukemia. And we also have this very the short panel and the 35 genes and DNA and RNA panel, which actually turnaround TAT is much quicker than the large panel, and clinicians also like this kind of short panel, especially for these limited tissue that they need answers quickly instead of waiting for large panels. And for the heme, also we develop this quick short panel and the colon cancer panels. Of course, that we have R&D program that we're developing more tests to meet the oncology clinicians' needs. And this is the platform that I mentioned earlier that is a minimum residual disease, the technology that we developed. And this is using the prostate cancer as an example. And you can extract the tissues and then run the large panel, get the tumor unique markers, TUM. It's like the fingerprint of the tumors. Then develop the highly sensitive digital PCR-based assay and track these markers in the blood. And we call it onco-tracking. And so currently we're running a few large studies on the prostate cancer to help the urologist to follow the prostate cancer patients that status poster total prostatectomy, intent of cure, and also active surveillance programs. So this one is genetic testing. As I said, that this is to the end of patient journey, and when patient has cancer, they also worry about whether sibling has cancer potential, and also their kids, right? So for pathology, for pathologists that we usually, you probably all familiar with the Lynch, probably the CRC, because to perform the MMR is become our routine now. Okay, and but as a pathologist, we usually do MMR, and when the if the MSH2 and the 6 deficient, okay, you often say in the report, say, okay, suggest for genetic counselor or testing. And if MH1 and the PMS2 deficient, and it's getting a little bit tricky because whether you need to do the methylation for MH1 or not, or do BRAF, right? And many people is not aware of that. If they do BRAF testing, when it's negative, doesn't mean it's Lynch. It still has a chance that MH1 promoter is methylated. So we recommend to do the MH1 methylation straight. So, but at the end, and you still need to run genetic panel, and to do that, of course, there are some company offer that, but we combined all these together into our program offering. So we have Lynch, they are testing, right? So the breast cancer probably most people familiar with, but the pathology rarely deal with it, but it's part of our offering. Another thing that prostate cancer, most people are not aware. Actually, prostate cancer is actually most genetically inherited, and I didn't know until we started to build this program. And prostate now actually is our one of the most successful product that we offer to the market. And the NCCN guideline actually recommend genetic testing for prostate cancers. And so with that, I kind of finished the patient journey and by offering tests, right? I want to come back to the tissue diagnosis and talk a little bit more about our digital pathology platform. I mentioned that last year we're total digital. Here is our program, and I want to go through it a little bit and see that that could be helpful for your department. Okay, so the slides come from the GoPath Histology Lab, and here is our stack of slides. Could be HE slides, immuno slides, or cytology, and we put that into these high throughput scanners, and then these slides digitize it, then automatically upload to our cloud server, and assign to each individual pathologist. Okay, so we program all that so when slides are scanned in the scanners, it's automatically. There's no you just scan it into the cloud. Then we use an iPad or computer. You can access these cloud images like this way, and then you can view these images on the iPad or on your desktop computers. And you can sign. What we do that we sign out in our GPIS, our LIS system developed by ourselves. And then also you can sign out your cases in your LIS system. And of course that we can interface our IMS with your LIS system. And so this way that you only need to one login. But most of people currently they adopt the digital. They have separate this. They view the images in a separate system. Then they sign out in the LIS system. And because after they make a diagnosis, they just put diagnosis in the LIS system and sign it out and reporting. So we have access the different models of scanner, and you can see you have 5 slides, 40 slides, 120, and 400 slides. And in order to actually advance the digital pathology, GoPath actually set up a separate company called Digicel. You probably see the Digicel name in the meetings, like a digital pathology association meeting, DPA meeting, ASCO, CAP, and this is actually essentially GoPath company, and we are developing the software and the hardware, and so this way we can provide the service for many of you and on the digital initiatives, right? So software, hardware, so one-stop shop, and so this is the whole process how we make it as total digital. This is slides that I want to show you that this is essentially my office, and you can see that how I do it on a daily basis. And you can see on the big picture that this is desktop version, right? You can see the images, and then the right side is the requisition. So these images that allow you to look at one after another one, the slides, and then I have iPad here. If I need it, then my computer. Okay, the left side you can see that at the bottom, that's the dashboard. Okay, that's the dashboard that, and every day first thing that I'm going to the dashboard, look at all the cases here. The far left is the list of cases, then the macro images, and then on the far right is function tabs. The function tab has a message board, also diagnosis board, and the far right is the PDF. It's kind of small. If you click that, it's at requisition. Our requisition actually is linked to our IMS. So it's, you don't need to carry your requisition in your suitcase anymore. So I'll encourage you that to scan this barcode, QR code here, using your phone to scan this QR code, you will see de-identified whole slides image on your phone. Okay, I'll give you a few seconds to do it. I encourage you to do it while I'm finishing these slides. So you can use in the desktop to view all the images, very nice, and also you can use in the iPad. Okay, this is the left side upper is iPad. The images that really look very good. I don't think that as a pathologist we have any problem to make a diagnosis based on the digital images. There are a lot of papers out there to prove that, and this IMS we developed really nice that actually serves very well, and I hope by now you should be able to see the images. And so let's talk a little bit about what the advantage of be a total digital, right? People say, I like to read the slides, that's fine. And but if you attended all the recent meetings, people talk about the advantage of digital. My personal experience is that, so we scan like 400 to 500 slides every day, okay? And so the good part is that, for practical purpose, your histotech doesn't need to look for slides anymore. You just any slides, we can just simply go to the computer to find it. Slides immediately available. Okay, so that's one. Your slides will never break again. Number two, that slides color will never fade away, right? And another thing that you can organize your digital images. Then we can apply subject to AI studies or that part, right? So this is all. One of the most advantages that for consultation, if you have difficult cases you want to show to the colleague, you can just text him, say, hey, can you look at this case? And in your facility or in remote and other places that you have friends that are really good at something that subspecialty, you can just simply send this QR code through the text or through the email, and because it's de-identified, so it's a HIPAA approval. And then like curbside consultation, then your friends, your colleague can quickly give you comments, and this is is very, because of we have this platform. We are building now a national digital consultation network right now, and because we have this capability, the core IMS allow us to build that, and we're probably going to finish that in this year, Q1, Q2. So we are very excited to be a total digital. And also, I forgot another thing, that the benefit of digital, you don't need to sit straight, look through microscope, eyepieces anymore. How many pathology colleagues have neck problem, back problem, and actually I noticed that many of pathology now, read cases standing up, through the microscope. That's part of the reason why we need to be digital. Digital, you can still sit down and read the cases. That's the nice part of it. And so I think that, it's good to be total digital, right? So, but the current workflow, our histology workflow, actually is not optimized for digital. Here we come up with a system called Tissue Workflow Optimization for Digital, TWOD for short. And I'm using the prostate biopsy as an example. And you can see that the regular cassette, left yellow regular cassette, you can see, and then we created this special TWD cassette. We essentially divided the cassette into three chambers or three lands, and the blue stuff is a sponge. Okay, so these cassettes that we give to urologists, okay, and at the urology clinics, just 6 cassettes can take 12 to 18 core biopsies. As you know that urology usually do 12 core biopsies. They put in the 12 jars, formalin jars, then send it to lab. And when we received it, right, we have to pick each tissue from each jar and put it in the cassette. Okay, the 12 cassette, 12 jar, and take time for PA to pick each fragments from jar, often lost. Okay, and the tissue is fragmented, and so it's all. Currently, we are practicing. I would say 99% of the lab is practicing this way, and but it's what that means that we have to cut 12 cores, we have to scan 12 slides, okay, 12 slides. So this TWD system will change that, okay. So for 12 core, literally you just need to using the 4 cassettes, color coded. Like blue is always A, B, C, pink is D, F. And then a urologist put the tissue core into the each land. Okay, I don't know if you can see my cursor. Each land that will be like A, B, C. Okay, so next slide we'll see how we process it. When we receive these cassettes, and we just open it up, and you can see all the tissues stay here and no fragmentations. Okay, then we put this on our camera stations. Okay, this is actually digital camera on the right side, and then take a photo. Okay, then we build a small AI program to measure the length automatically, and this all information get into our LMS immediately. Okay, so then you take these cassettes out, then cover with the lens paper, then close it, then process, send it to processing. So you notice that a technician hasn't touched the tissue at all. And you don't have to pick up each fragment from the formalin jar anymore. There is only one formalin jar. We put this into a cassette into big formalin jar during transportation. But when we receive it, you don't need to pick up fragments from each 12 jars anymore. So this is will save tremendous time and also improve the tissue qualities. And urologists, clinicians love this process. Okay, and you can see that when after the processing, you can see the tissue is kind of the sponge change color a little bit. You cannot see from the bedding stations, but the tissue is there, and then we just put the 3 core on the 1 paraffin block, and each core actually is color coded. Okay, so you will not mix this each core, and then we cut this tissue block into 1 slice. Okay, so this is also save a lot of time for prostate biopsy, embedding and cutting, and the histotech love these ideas, and so when we scan the slides, we scan the 3 core. This will be A, B, C. We have indicated here. It means that it starts from here is A, B, C. Okay, so we have 2 levels sufficient, and we viewed it in our IMS, and 3 core at one time, and so this is something really, I think I believe that more and more people adopt this, and will really optimize our histology workflow, and save time, save money, and more efficient for pathology, for digital solutions. All good. Okay, and this platform is available. Currently, it's only for prostate. We're now working for GI biopsies and also for prostate, for bone marrow, and we can expand to other subspecialties. And I think that by now, and I finished most of my presentation in terms of our molecular platform and digital platform. Okay, and I hope that you enjoyed it. And next is that, okay, how can we bring this platform to you? Okay, and you're probably thinking that about some of the things, and there are many ways to partner with you, right? And say, hey, simple one that you can send us the cases to us for consultation for that, or if you want to build some of the molecular capability, we can help as well. And of course, that the main message for this webinar is that how can we partner through this merge and grow program. Okay, and these slides show you that on the left side you have GoPath is Delaware registered company called GoPath Global. It holds 100% of GoPath laboratory, and the laboratory is doing all the technical component. Then we have GoPath Associates as a professional entity and read the cases, and all pathologists is in the GoPath Pathology Associates. And then the concept of merge and grow is that small practice like your practice work with at the hospital, community-based hospital, independent. We can join our force together, and through the professional entity, then we can internalize the molecular test. You don't need to send to elsewhere. We can internalize the test. Then we can you can be part of the GoPath Global. Okay, and this is of course high level of the merge and grow, and of course the details can be discussed later if you are interested. And here is the benefits. Okay, our title is mentioned that empowering pathology partnership, for growth and the rewards. So what is the growth and the rewards, right? So I will spend a little bit of time here to make sure that we're all on the same page. So three things, right? So improve the revenues, okay, reduce cost, and improve profile. And the last one, that create a potential exit strategies. Okay, so why we say that we can improve revenues? Okay, then first, probably very important that we can internalize in molecular send out, right? So if we become one entity, then all the molecular sendouts is essentially internalizing. Okay, and then that will certainly benefit, right? And then additional AP business in the region to be brought by GoPath sales team. And some depends on the size of your practice. You probably don't have much outreach program. You probably don't not hiring salespeople, right? And in a community base. But what we can do is that we can help to bring more business to you, and this way that you can utilize the GoPath resources. Another thing is like case sharing and cross coverage. Let's say your practice has some specialty that we don't have or others don't have, that we can using your pathology to cross cover and vice versa, right? So the also that and you can participate in the GoPath digital tissue biobank, and so this way that when works with biopharma, that will benefit that, right? So also another thing, the digital sign out is also important now. We have CPD codes for the digital sign out, and there's issue that whether it's paid now, but down the road it will be paid, right? So this is definitely will improve the revenue, improving your bottom line, right? And another is the reduced cost. By joining the force together, and we can help to, like say, locum, right? It's hard to find a pathology now, and even we find one, locum is often expensive, right? So by joining the network together, that we can have other pathology to cover you while you have pathology on PTO, and we GoPath has a revenue cycle manager, billing, and a human resource, all other things we can work together, malpractice insurance, all that, and so improve profile. Improve profile is also important, and by working together, this will help the molecular turnaround time and the services, and will strengthen your relationship with your clinicians, oncologists, and because now you are more in with the molecular, right? So you can access our molecular team for any questions and updates, and also that with digital platform that you can also improve the like offsite frozen sections, and if you adopt the digital program. And of course, that we cannot list all the things here. And another thing is very important that by joining force together, that we can create potential exit strategies and also make your practice to avoid any vulnerabilities, stability, all that. And Dr. Bloom, can you comment on this, because that's the important part?
Yeah, Jim, thanks. So obviously there's lots of benefits, and you have lots of choices, right? So precision medicine has happened. We have to execute all these technologies. There's not going to be an option for us. And really the fight for me as a pathologist is the continual attempt to try to marginalize pathology, and us explaining why we can't be marginalized, why it is so important that the pathologists, especially the community pathologists, stay actively engaged in the care of those local patients. The old way 40 years ago was if you had something that was difficult, you just send it out to an expert and they wrote an opinion and send it back. And that community pathologist was marginalized. One of the things that I got to do at Clariant was create the concept of technical professional split and how you re-engage pathologists back in the care of patients for the specialty care. And I see digital pathology as being sort of the next wave that's ready to happen, and GoPath sort of helping to lead that front. So even if you're going to do molecular testing, there's still the concepts of heterogeneity and spatial relationships that you just don't get out of an NGS panel. You'll know that things are present, but you don't know where they are. You don't know how they're distributed across tissue. And those are things that are absolutely critical for pathologists to be able to understand and to be able to communicate back to those clinicians. And it's not just that, well, it would be better for us to do it. It's the new wave of therapies are going to demand it. And so, my pitch to you guys, or my emphasis to you guys, are you have to pick your partners wisely. And I think this merge and grow strategy is a unique opportunity to, one, get you some revenue streams that Jim described that you otherwise wouldn't be able to get, increasing sales forces, cross-covering each other's services, getting subspecialty expertise where you might not have it, reducing costs just by merging things that are getting more and more difficult to maintain, human resources, revenue cycle management, malpractice, et cetera. So all of these things become critically important. It becomes so important to have a partner that can work with you. And the beauty of the merge and grow is it gives you many different ways in which you can work with GoPath and work with each other to achieve better patient care and better stability for you in your practice.
Thank you.
Thank you, Bloom. Thank you.
Yeah. Thank you.
Thank you, Dr. Bloom. And thank you, Dr. Liu. I'm going to go on now to a polling question or two, but before I do that, let me turn your attention to the bottom right hand of your screen. You'll see a box labeled Q&A, If you have a comment or a question that you'd like to pose to our speakers, Dr. Liu and Dr. Ken Bloom, you can type that in right now, and we'll get to them in just a moment. But first, let's go through some polling questions, and if we can then move in the polling apparatus here. Are you a member of a private practice, community-based, or are you employed by a healthcare system? Let's see, we've got a very interesting, almost a 50-50 split here. It's going up and down a little bit. Sometimes it can be hard to know exactly where you are, but 1 out of 3 in private practice. Very good result. Let's go to our second poll question here. Does your practice want to improve its molecular diagnostic and/or digital pathology capabilities? Let's get a thing. Well, there's great unanimity here, as we might expect, so our polling is working well with 1 or 2 reluctant exceptions. Thank you very much. And let me go to the third poll here. And of course, would you like additional information about Merge and Grow or any of the very many services that have been outlined today offered by GoPath? And you should know, of course, we'll get some follow-up where you can also respond, and you'll be private in those responses. So I would encourage you to learn more and to participate in any follow-up email here. I can see that we've got a very high level of interest here. So let's close those polls and then begin to ask a couple of questions. We had some technical glitches at the beginning. I think you're all aware. So we're going to go a little bit past the top of the hour by about 5 minutes or so. So let me dig right in. And Dr. Liu, I'm going to pose this question to you. Some of the tests that you've mentioned in your portfolio at GoPath Diagnostics are very innovative, and certainly they're on the cutting edge. Are there specific pathologists in the GoPath practice who are assigned to explaining these sorts of results and these tests to clinicians and even patients? And then is there a consulting service also attached to the practice? Dr. Liu.
Yeah, thank you. Thanks for that question. And we're certainly encouraged by the polling questions answers, right? So, yes, that's a great question. And because some of the tests that is not a common, tests that pathologists are dealing with, right? So yes, we do have a team that MD, PhD team to answer the questions. We often, talk to our clinical colleagues, very often. And so usually when they order these tests, we already contact each other, right? So then if we have results, we often call them, explain to them, what does it mean. And that's how we will build our business and steadily and through years. And so another part of the question is there any consulting service attached to the practice? And we build in our team. Most of our the business that we handle ourselves, and we can serve as a consultant for you if you like. And if I understand that questions correctly, so.
Very good, thank you. Dr. Bloom, let me ask you for a brief response to the same question. We are all aware that the new tests, innovative and cutting-edge tests, often require a great deal of explanation and even interpretation for clinicians. So that's certainly a rising wave in the midst of all this precision medicine, isn't it? Dr. Bloom.
Yep, sorry, forgot to take myself off of mute.
Okay.
Yeah, Bob, thanks for that question. This has been ongoing for the last 20 years, really, with the rise of companion diagnostics, really explaining to clinicians and patients what these tests mean, and in many cases, how they should be used and when they should be ordered. And so there's really 2 parts of that. One, is there's obviously experts in the College of American Pathologists and other organizations that help derive some of those standards and can help educate. But it's really important that you've got some partnerships in labs that can help get those, explain which tests are emerging and get you prepared so that you're ready. To me, it's really important that pathologists not always look like they're behind the 8 ball, that the questions come in and then you scramble trying to find answers. I think it's very important that labs like GoPath and there's others out there too that attend the clinical meetings. Like, Jim expressed how they go to the urology conference, to ASCO, to ESMO, to these things where the emerging oncology tests and emerging clinical tests are coming into vogue so that we can stay educated on those tests and therefore produce materials and educate all of our pathologist colleagues on how to address those questions. So to me, it's preparedness. It's giving you tumor boards in a box that you could go to your tumor boards and explain the significance of germline testing in prostate cancer and why it needs to be done. And then explaining what they do with the variety of results when they get them back, giving them flow diagrams so that they better understand, hey, if I order the test and I get this result, this is what I do next. So I think labs like GoPath are absolutely critical in educating the community pathologists in this endeavor, and of course in conjunction with places like the College of American Pathologists and others.
Very good.
Yeah.
Ken, thank you very much. And I think we'll begin to wrap up a little bit. I do want to note we've had several questions around support for GoPath partners with revenue cycle. Let me suggest you contact GoPath directly and specifically so that they can deal with you individually. You'll see there that's very easy to get in contact with Dustin or with Dr. Liu. And any other questions, I'm sure they'd be very happy to answer them. But let me now go ahead and begin to wrap up. But before I do, I want to mention that Dustin Sundheimer, who you heard from today, the Director of Commercial Operations for GoPath Diagnostics, will be at a booth at the Texas Society of Pathologists meeting. That's just next week in the first weekend of February in the beautiful town of Austin, Texas. So if you're there, be sure and say hello to Dustin and hear some more about GoPath. And if you're close to Austin, breeze in. Don't miss that meeting. It's always quite good. So let me begin now to wrap up. I want to thank Dr. Ken Bloom, as always, for sterling guidance and discussion. I want to thank Dr. Liu for a wonderful, comprehensive presentation of the patient journey as it's outlined at GoPath Diagnostics, workflow optimization, and employing and deploying all the latest technologies in a very intelligent and careful way to benefit patients and to benefit the practices and the pathologists who participate. That's really very wonderful. I want to thank you. In addition, I want to thank GoPath Diagnostics for sponsoring this webinar. Finally, I want to thank all of you participating in the audience for joining us today. It's been a very interesting session. I'm sure you'll want to follow up, and we will post this so you can have some review. And with that, I'm going to send us to a close. So thanks to Dr. Liu, Dr. Bloom, Dustin Sundheimer, GoPath Diagnostics, and all of you. And with that, I'll bring today's webinar to a close.